Good afternoon, Hatters. I want to welcome you to today's webinar. Our incredible COVID response team is going to join in a few minutes to help provide a real-time update as we continue to keep our community informed of our planning and our decision-making as we gear up for the start of what I am certain will be a productive and collaborative semester. I can't help but be impressed by the response and support we have received from all of Hatter Nation, including alumni, parents, faculty, students, staff, and our local and regional partners. All of you have been nothing short of extraordinary throughout the set of public health challenges we have had to confront over the last 2 years. You continue to illustrate for me the grit and resilience of Stetson in the face of some really remarkable health and safety issues that continue to impact the globe and certainly our own community. I'm sorry I'm not able to be with you for the live webinar this afternoon, and my sincere thanks to Provost and Executive Vice President Noel Painter for moderating today's discussion. Over the last several days, I've been working intensively with other college and university presidents through the Council of Independent Colleges Presidents Institute. I am working with other higher education leaders from around the country on the issues we all face now and in the near future in responding to the pandemic and to address the economic and other impacts to higher education more broadly and for Stetson specifically. As I indicated in my inaugural address, despite the complex issues we face, Stetson will not only be okay, we will be more than okay. This community has already demonstrated an exceptional ability to adapt, to persevere, and to care for one another as we move a Stetson education forward for our students. I know that today's webinar will be helpful, and I also know that our colleagues are ready to respond to any questions you may have. Stay safe and stay well, and I look forward to seeing everyone back on campus this weekend. And as always, go Hatters.
Dr. Smith, thank you for joining us today.
Well, thank you for having me. It's a real pleasure, and I've really enjoyed working with Stetson. I've got to say, of all the organizations I've worked with, none have been more forward-thinking and proactive than Stetson in terms of trying to get back on track with normal activities as quickly as possible, but doing so very, very safely. And I've been really impressed with the way that Stetson has sought information and incorporated that into your plans, and it's just been a pleasure to work with you guys. So, we're here, I guess, to talk about who is this Omicron variant character that we keep hearing about. Omicron variant, like the Delta variant, is a variant of the same coronavirus, the COVID-19 that emerged back in 2019. The variations or the mutations have been thus far largely in what we call the spike protein. So interestingly, I think everybody now could probably draw a COVID-19 virus, but it looks like a Jack's ball. It's got the sort of the cylinder in the center, the sphere in the center with the little spikes going off of it, and those are going to have a protein on the outside. Those proteins help the virus to stick to certain receptors in your body, and those are the same proteins that your body is going to recognize if it recognizes the virus, if you have immunity, and it'll say, hey, we know this invading pathogen, and it's going to go ahead and attack it. With Omicron, those changes have been in the spike protein in a way that makes it much more transmissible, okay, easier to catch. And if you are a virus, that is exactly what you want, okay? You want people to walk around, meaning they're not terribly sick, but you want them to walk around and you want them to spread you around, because there are no boy viruses and girl viruses that come together and have baby viruses. Viruses are 100% parasitic, and they can only replicate or reproduce by hijacking your own body system. So very, very transmissible. Just to give you some kind of real world numbers about how transmissible, the R naught or the reproduction rate for the original strain was about 2.5. And that means for every person who caught the original strain of COVID-19, you could expect that person to infect 2.5 people. So, think about it this way. If you and I got it, probably 5 more people would catch it from us if we weren't careful about isolating and doing what we need to do. With Delta, that number was about 7, okay? So a little more than twice as transmissible. And now with Omicron, that number appears to be about 10, right? So significantly more transmissible than the original strain. That is due to that change in the spike protein. it is a little more difficult for your body to recognize. And so that means that we're seeing increase in breakthrough infections. So people like me and many of you who have had COVID-19 in the past, I've had 3 vaccines. They're a little less protective than they were when the virus was closer to that original strain. And that's because as it continues to evolve and change, we see that the body is less and less capable of recognizing it. And those vaccines and the prior infections, those educated your body to recognize the original strain or the strain that you came down with. So a little bit less effective. There is some good news, though. This one seems to be much less likely to invade the tissue in the lower lungs. And that has to do with the affinity for that changed protein to the receptors lower in the lungs. So that's a good thing. And that means that what we're seeing is that the vast majority of people who are getting this have a lower acuity or a less severe course of illness than what we saw, particularly with Delta, which hit really that kind of middle-aged and young adult population very, very hard. We're seeing less of that. But I have to caution everybody, don't get too complacent. And the reason is this is still a fairly serious respiratory illness. And because it is so transmissible, it's a bit of a numbers game. And even if we see a lower percentage of patients who are progressing to a more severe illness, if we all get it at the same time and that sample size is huge, we could still overwhelm the hospital systems. I can tell you that hospital workers, healthcare workers, your primary care physician, and all essential services, police, firemen, none of us are immune from an infection any more than anybody else. And so I think that with this one, what we can see is that while the severity of illness may be lower, we may see some significant disruption in our social order just because of the sheer number of people that are going to be out from work with this. Changes in the spike protein can continue. This doesn't necessarily mean that this is the last mutation that we'll see in this. In fact, it probably is not, and there are other variants out there. But this one has been really successful. And right now, as of today, I just checked the CDC, 97% of all the samples that they analyze for the United States right now are actually this Omicron variant. So it's completely displaced Delta, and the original strain is all but gone. So if you were to come down with COVID-19 now, the Omicron variant is the most likely cause in the United States, which is really pretty remarkable. This was only actually identified in South Africa and Botswana in late November. And within just a few days, the doubling number was identified at being 2.5 days. So every 2.5 days, the number of people who've had this infection in those countries doubled. So just in a few days before the end of November, it had already become the dominant strain in those countries. Truly remarkable how quickly this is spreading. Is there a light at the end of the tunnel? I keep getting asked that. Perhaps. This might be so transmissible, so contagious that band of population out there that never got vaccinated, they're likely to come into contact with this one because it's so easy to catch, and we may actually start pushing towards some herd immunity. So this is very much a mixed bag. I'm very pleased that the virus has behaved a little more normally and it is causing less severe illness. Certainly, it's a real challenge that it's so contagious and that it could impact our society in different ways. Maybe not through mortality, but certainly if you take that huge percentage of the population out of the workforce for any day, we could all expect to see some disruption in our daily lives. My advice is largely unchanged. While vaccination is a little bit less effective against Omicron contraction, it does still seem to protect from severe illness, which is great news. The monoclonal antibody therapy, if you had already been infected and you were kind of in that medium range of being sick, where you may be in the hospital emergency room, that therapy seems to be less effective. There's some really good news about some oral antiviral medications that are approved under EUA, and right now manufacturing is spinning up to be able to deliver those throughout the state of Florida. Those medications seem to be very effective against this. So I have a lot of hope here that if we can get through this little period of time, that we're going to be in a much better place. But still obviously wash your hands, mask, distance. If you feel sick, please get tested. I can certainly share a link. The Daytona Speedway, we can do all sorts of testing there. The Orange City Central Care has testing available. There are home kits available. But certainly, if you feel poorly, stay home. The chances are that if you have COVID, if you have this Omicron variant, you could infect 10 other people. Just statistically, average activity is going to kind of give you that sort of spread. So, think about being a good steward, a good citizen. Cover your mouth when you cough, and obviously stay tuned for any changes in the recommendations from the CDC. Also, obviously, never been a better time to quit smoking. If you smoke, never been a better time to adopt a healthy diet and some exercise, get some rest, do all the things you do to keep yourselves healthy on a day-to-day basis. But that is a nice little, I think, nutshell of what's going on with Omicron, and I'm happy to answer any questions anybody has.
Thank you so much, Dr. Smith. And I love the reference to the airplane movie at the end. Well, maybe that wasn't the exact intent of your.
Right. Don't call me
I have
Shirley.
many questions myself, and which I expect will be asked at the end. But I wonder if you could elaborate just briefly before we move on about the effect of boosters and whether that's something that you are recommending for our population as well.
I am recommending boosters. The original strain, seemed to be very, very, very much impacted by the shot. Okay, and then you got your booster, and we saw that was very effective against Delta. Patients who have had their booster, sort of 3 doses, and they are actually looking at a 4th dose that's being evaluated right now, they are protected. We can see already emerging statistical data that shows you're less likely to progress to a more severe form of illness if you've had your booster. So if you haven't gotten your 3rd dose, please go out and get it. Anecdotally, I can tell you that most of the people I've talked to that got their 1st dose said that was fine. 2nd dose, they didn't feel so great. 3rd dose seemed to be more like the 1st dose. People didn't have as many reactions to that. So certainly mileage may vary, but I would recommend getting the shot. It's still the safest way you can prevent yourself from spreading this to others.
Thank you so much. And Dr. Smith will be a part of the panel at the end of this webinar as well, where we'll answer more questions at that time. I'd love to introduce also the Stetson team that is so closely monitoring and advising on the various changes and decisions that are being made. Lynn Schoenberg and Terry Radwin, our co-leaders of the Safer Stetson Task Force, and Johanna Burgos, our Director of Health Services at Stetson. These 3 have been such wonderful, incredible leaders throughout this entire pandemic for Stetson's response and the good decisions that we're making as an institution to be as safe as we possibly can and continue to meet our mission. Lynn, can I turn it over to you to start us off?
Absolutely. Thank you so much, Noel. And as always, Dr. Smith. So I welcome you all back to spring 2022. It's so good to be here with you. We wanted to talk a little bit about the changes that we've made here on campus in response to Omicron and what we know about it and the things that Dr. Smith shared. We did make fast movement to move back in our tier system to tier 3 and also to bring back all masking indoors. So right now we are in tier 3 and we have masks required in all indoor locations unless you're by yourself. And Terry will talk more about those specific changes. I wanted to talk a little bit more about the rationale because those of us who are making these tough decisions, we want you to know that we take them very, very seriously and that we try to look at all of the possible information that is at hand that we have. We look at the local rates in the counties, the multiple counties where we have campuses. We look at the hospital rates and how the hospitals are doing. We look at our own rates on campus. We look at how the virus seems to be progressing in our particular population, how sick our folks are, what the CDC is saying, what the Department of Health is saying, what Advent Health is saying. It takes a lot to make these decisions. And what we know is that we know there's folks on this webinar who think we're being too lenient and that we should tighten more. And there's folks on this webinar who think we're being too extreme, that we're doing too much right now. And then there's a bunch of people who think we're right in the middle. And we hear you all. That is something that we really wanted to say. We hear all of your voices. We're not ignoring you. At the end of the day, we have to make really hard decisions, and we need to make them more based in all of that health information and data that we're receiving than in public opinion. So while hearing you, we have to make decisions that we think are best for Stetson, for all of us as a larger community. And so number one for us is health. Thank you, Dr. Smith, for mentioning that we've been putting that first since the beginning of this pandemic, the health and the well-being of this overall community, so that we can all engage in the transformative learning experience that we believe in, that Provost Painter mentioned, that President Rolks mentioned, so that we can be part of this educational mission together as a team. We need to stay nimble within tiers. Our tier system is strong. It has helped us this entire time. We've learned as we've gone. We've learned what works well. We've learned what doesn't actually really seem to have much impact for us as a community. We've narrowed in. We've gotten stronger and better at defining what our tiers are. We're in a full tier 3 with full masking. And we feel like that's a good spot for us to be in right now. And we're going to stay nimble. We'll reevaluate at the 2-week mark from the first day of class. The truth is we reevaluate all the time, right, Terry? We're constantly reevaluating whether we're in the right tier and we're doing the right thing. And what would this look like? What would that look like? But we're going to take a hard, large collective look at that 2-week mark. In the meantime, we have massively expanded our testing for the start of the year. And I'm going to talk specifically about that here in DeLand. And I know Terry is going to talk about it at the College of Law. So we have expanded so that every member of the DeLand Stetson community can get tested right here on campus. Dr. Smith mentioned some great resources in the community. You can also use those, but we have testing for you right here at the Hollis Center. You all know where that is. We're pretty efficient. We get you through pretty fast. If you are an unvaccinated, not campus cleared individual, then you go through our gateway testing process. That is required before you can move about campus. So students, please don't go to your room, don't go to have lunch in the commons, please go right to gateway testing. And that is PCR rapid nasal testing. You will get your results around 30 minutes while you wait for them. That is for folks who are not campus cleared. For everyone else in the community, we have expanded and said, we want you to come get tested. And thank you so much for over 250 people who've already done that on campus. Come get tested. It's PCR, it's saliva, about 48 hours, sometimes faster, for your results. And let's try to help funnel and get our folks isolating who might be positive and don't even know it, which is definitely what we've been seeing from our results so far. In the community, you might have to wait quite a bit to get a test or to wait for results. This is a way that you can come and get testing fast. So from Wednesday till next Monday, we have that open option available. Please do be patient with us. We purchased an additional 1,000 tests to start the new year. We have staff, right, that are helping make that happen, but we did another call for help. So if you're able to help, please sign up to help us with our testing. We didn't plan on this level of expansion right at the start of the school year, and so we need some help. And also we've got some folks that need to isolate or go into quarantine, and that's taking from our pool of people who can help. So please sign up and please be patient with us. We have ongoing testing throughout the school year, every Wednesday on campus for everyone. Anyone who wants to get tested every Wednesday can come and get tested at Stetson, PCR testing. We also will continue with our mandatory testing group. Those folks will continue to get tested on a regular basis. I can share some results that we already have back from our testing here in DeLand. This information always goes on our website. We're being very transparent with it. There just might be a little delay in posting it, but we're getting it up there pretty quick. So for gateway testing so far, we've tested 65 people, 10 positives, 15.4% positive from that group. Most of our students come Saturday and Sunday. So we have a very large group of people coming Saturday and Sunday, and those numbers will massively go up. For our voluntary asymptomatic testing that we've been doing, we have results back for 222 people. 17 of those folks were positive, and that takes us to 7.6%. We also have an additional 40 people who have been tested and are awaiting results right now. So I'm gonna welcome my wonderful co-partner Terry to talk about how that's playing out at the College of Law, and also reminders about what Tier 3 and mask looks like.
Thank you. So I'm going to pick up right where Dean Schoenberg left off, talking a little bit about testing here at the College of Law. Our testing looks a little bit different here at the College of Law. It's all combined together, so we don't have different types of testing depending on the populations. And right now, just like the main campus, we are in the middle of gateway testing. Because our semester starts a little later, we've only had one day so far of gateway testing, a fairly small event with about 50 people tested with just one positive. So that's been good news so far. Our next testing dates here at the College of Law are January 13th and 14th. And that testing event is open to anyone at the College of Law. However, just like at the main campus, if you are not cleared, and that applies no matter whether you're faculty, staff, students, if you are not cleared, that is a required testing event for you. So please do make sure that if you're not clear that you go ahead and sign up. But again, it's open to anyone in the community who wants to test. So even if you don't have to test in gateway testing, you are welcome to do that testing. And that's done via Sign Up Genius that we will put a link to as well. I want to move from that to Tier 3. As Dean Schoenberg noted, we are in Tier 3 throughout the campuses, and the Tier 3 guidelines are all available on the website, but I just want to hit a few of the highlights about what Tier 3 means. For starters, Tier 3 means that we are still having classes in person, having them with some distancing in the classroom format. It also, as Dean Schoenberg already noted, includes face coverings in all indoor settings. And that is true anytime that you are not by yourself in an individual space, such as an office, or if you're in a residence hall in your own room with your roommates only. So if you have visitors in your room, if you have someone extra in your office, if you're in a shared workspace, or you're anywhere indoors in a shared space, then you are expected to be wearing your face covering. It means that in-person groups are generally limited to 50 persons and should abide by physical distancing as well. There's also limitations on the number of guests that you may have in your residential space. It's limited to 2 guests, 2 Stetson guests per room, 1 overnight Stetson visitor, and except when sleeping, face coverings are required when you have guests in your room. Non-Stetson visitors are prohibited with the exception of the period in time when we are moving in students. Then you can, of course, have non-Stetson visitors who are helping you move yourself back in. For employees, workplace meetings in person are limited to 50 minutes and require 3-foot minimum distancing if you're in a classroom format and have a group together. And spectator-heavy events are still limited in size. So that's really, we're talking about athletics, our music programs, things like that. And the capacity limitations you can find on the tier page on the website. Again, if you're ever looking at what the tiers have, the Safer Campus webpage includes all of the different tiers, a summary of the major points for each of the tiers. And so we'd encourage you, if you ever have questions, to go ahead and take a look at that website. And it also indicates at any point in time which tier we happen to be in. Finally, I just want to remind you, if you didn't hear it before, the current mask policy, masks required in all indoor settings with the 2 exceptions: if you're alone in your office, or if you're in your dorm room only with your roommates. And with that, I'm going to turn it over to Ms. Burgos, our Health Services Department.
Hey everyone, I'm Joanna, Director of Health Services, like I was introduced. I just want to share with you our current cases on campus. We are collecting information from students that are still off campus. So these numbers include everyone and anyone that has tested positive in the past 5 days, according to the new CDC guidelines. So we currently have 60 people being monitored. That means we actively have them into our tracking system pending clearance. But this also, as I said, this includes College of Law, DeLand, and students reporting from off campus, and even some international students as well. And that includes employees isolating at home who have not been on campus yet. So we have, out of those 60 who we are monitoring, we have 48 who are positive. In DeLand, 45 positives, and in College of Law, only 3. College of Law will start gateway testing by the end of next week. So we expect some results from that. We did expect some cases to rise with Omicron. We are prepared to handle and tackle those. We have a very solid contact tracing team. We respond way less than the required 48 business hours. DOH always advises that we contact trace within 48 hours, but we have always been able to reach within 24 business hours, especially our residential students. As Dean Chambers said, please be patient. Sometimes because of the increased load, it doesn't, the contact is not immediate. So make sure that if you test positive or you have symptoms, isolate and wait for our call. If you report it, usually, it takes some time for us to enter it into the system, properly process your record, and then contact you. I also want to discuss some changes. This information is also available on the dashboard. It's public information, so you can go to Safer Stetson and the dashboard is there, and you can actually find the cases per employee, student, and per campus as well. So the CDC recently made some changes to the isolation and quarantine protocol. Currently, Megan, if you want to post that slide, thank you. So basically, the recommendations are here. If you're a positive case, regardless of vaccination status, you isolate for 5 days and wear a mask for the next 5 days after clearance. They recommend that you test on day 5. It is highly recommended. And if that test is positive, then we extend your isolation on day 10. Our contact tracers are trained that if we call you for clearance on day 5 and you still have symptoms, your symptoms are not improving, then we will extend your isolation for another 5 days, up to 10 days. So that's for positives. Direct exposures, if you're unvaccinated, this was a major change. Direct exposures, if you have not been vaccinated or if you're fully vaccinated, but your booster is due within the booster guidelines from the CDC, then we have to quarantine for 5 days and then wear a mask for another 5 days after clearance. Still, testing on day 5 is highly recommended. We offer testing every Wednesday at the Holy Center free of charge. So that's very good for our direct exposures, to be clear. Also, if you're a direct exposure with booster within no booster due time frame, you don't have to quarantine, but you should wear a mask for 10 days. So obviously these recommendations are enforced right now because of the facial covering policy, but this will always stay in place if you're fit one of these categories. And again, testing on day 5 is highly recommended as well. This is the link to this, or the copy of this is going to be posted as well. I also want to encourage you to get some boosters. We have our next vaccination clinic in partnership with the Department of Health on Monday, January 10th, from 11 to 3 by appointment only at the Holy Center. So as Dr. Smith was saying, boosters are your best protection. So are facial coverings as well. That's what I got.
Lynn, Terry, and Johanna, thank you so much for that information. And like Dr. Smith, thanks for staying on for the end of this webinar and answering some additional questions that I know our community has. I'd like to say a few words about the classroom before we move to that question and answer period. Stetson has committed itself for quite some time to having the best experience in learning for our students as we possibly can. We moved all of our classes online in spring of 2020, like virtually everybody in the world did. But then back in fall of 2020, we had a good number of classes that were in person, and we have augmented that number as we've moved through the pandemic. Last semester in fall of 2021, we had over 90% of our classes as in-person instruction, and we have a similar number this semester in spring of 2022. Students on your schedules for all of your classes, which for undergraduate and graduate classes in DeLand are starting on Monday or next week, and then in the College of Law at Friday. of next week, you have a pedagogical assignment of in-person or virtual learning. Very, very few classes have a hybrid of those two. We found it quite difficult to make that a good learning experience. And so only those classes that really do benefit from a hybrid learning pedagogy are in that format right now. For most of you, the format that you have for your class is going to be exactly how you will begin attending your class next week. Now, there are some changes that are possible. We do have faculty who will have to be isolating. We do have a process for faculty who have requests for medical accommodation or other accommodations to go through a process and receive that permission for their dean. But we remain committed to in-person learning for our students in those areas where in-person is the best learning for you to experience. We still have, after almost 2 years in this, we still have no verification of any transmission within a classroom at Stetson. And moreover, we have no verification of transmission within a classroom for any ICUF school, any independent colleges and universities of Florida schools. And in part, that's because of the mask requirement that we have in place. In part, that's because of the mitigation that we've done through cleaning and air purification equipment that we've invested hundreds of thousands of dollars in. In part, that's because of spacing changes that we've made for classroom. And going into the spring semester, we have the added benefit of having all of our Stetson University employee population, full-time and part-time staff and faculty, having satisfied our vaccination requirement, with the majority of those employees being fully vaccinated and with other employees having received an exemption. But all employees who have received an exemption have to go through a regular testing regimen so that we are ensuring that those employees on campus interacting with our students are as safe as they possibly can be in that scenario. So through the various measures that we've taken to make classrooms safe, we still believe that we can begin our classes next semester largely in the format that we have planned and offer that experience to you, students and families. I'll add one more thing before we move on to the questions and answers, and that is we do have metrics for moving classes in and out of an in-person to a virtual scenario. Those metrics are for individual classes, and we've had those in place for some time. They have to do with the number of students who might have tested positive or the number of people in the classroom who might have been exposed. We continue to monitor that. We are monitoring that now. We're monitoring that in preparation for our classes that begin on Monday, and we'll be communicating over the weekend about any changes that may be necessary given those metrics that we have and have had in place. We do not have metrics that would say after this certain point, we're going to move everything online. Moving everything online would be tier 0 for Stetson. That is part of our tier structure. And right now, as you've heard already, we have moved from tier 4 back to tier 3 with the various things that are associated with that move that keep us safe. And as Dr. Radlin said, for so many situations, we've required masks indoors unless you are in a separated space and alone. So that's our plan for education. We believe that our focus is in the right place for you all and your learning experience. Again, panelists, thank you for being here, and sorry for that long little explanation there. We do have a number of questions that have come through, and I'm eager for us to get started. Dr. Smith, I expect that you'll be quite the popular person in this question and answer period that we've got going on right now. One of the first things that was asked was about masking, social distancing, whether that remains effective and whether one or the other of those things is more effective.
Yeah, so masks are not all created equally, obviously, but when I talk about a mask right now, I'm talking mostly about these sort of widely available surgical double ear loop type masks. These reduce the transmission of viruses by about 15 to 30%, depending on how they're worn. Obviously, if this provides absolutely no protection to anyone, but it does keep my chin from getting sunburned, right? So you have to kind of really actually wear it, and you shouldn't touch it too much, but ideally worn, and particularly if you have 2 people, you can cut the transmission by about 1/3 if everybody's wearing their mask and wearing it appropriately, which is nothing to sneeze at, right? No pun intended. Social distancing, though, is absolutely a part of that. And so the way that the masks work is that the viruses, though they are smaller than the pores in this mask, the droplets they're suspended in are not. And so this kind of keeps everything sort of right here by you. So if you're a little bit further apart than you maybe would be, than if I were trying to whisper something in your ear, then you're going to get even more protection from the mask. So it's not an or, it's an and. I would use them both.
Perfect. And in addition to masks, in our music school, we have bell covers that go over instruments in various ways and other mitigating factors that tries to reduce the spread of the particles that contain Omicron and other variants. Perfect. Thank you so much. And one more question is asking really for your opinion on the changes that are coming from the CDC. There are so many memes and other things that are making fun of what could potentially be confusing.
Yeah.
But from both you and Johanna, I'd love to know about your confidence level with the changes that are being made.
Confidence level is high that what we're getting is based on an ever-changing amount of information that we get. I share that frustration. If you think it's frustrating to hear one thing one week and then hear something else the next week, try being the guy saying it, because that has been a real challenge. But the truth is, this is still a young science. We're still learning about this, and the virus is changing the game every day. So do I feel like the shortened 5-day window is reasonable? Yes, based on the data that we're seeing now. That's not just 5 days, but it's 5 days of being asymptomatic. And this one is different in that the incubation period seems to be about 2.5, 3 days. If you'll remember with previous strains, you would be exposed and it'd be 7 to 10 days before you would get sick. And so we're not really seeing that now. And so by the time you get to 5 days, if you're asymptomatic, you're more or less out of the woods, so to speak, from your previous exposure. And that's why they've dropped that back.
Perfect. Thank you. Since we're talking about masks, Dean Schoenberg, there are questions about availability of masks in the bookstore and things like that. Would you like to address that?
Yeah, there was a question about if we could get level 3 surgical masks at the bookstore. I will find out. I will talk to the bookstore. That hasn't been suggested to me directly. The bookstore's been very receptive when we've asked them to stock things related to COVID before. So thanks for that suggestion, and I'll bring it right to them.
Thanks. And Professor Radwin, there's been a question about masks in the library. I think I heard you say it, that it doesn't matter whether you're in a space that didn't require masks previously. If you're indoors, that is a requirement right now. Is there anything else that we should know or reiterate about that mask change?
No, that's exactly right. There were a number of leniencies that we put in place back in December, November and December, before the Omicron variant became the predominant variant. But at this point in time, we are in a universal indoor masking policy. So again, the only 2 exceptions are if you're in an individual office by yourself, or if you're in your residential space only with your roommates.
Have we committed to that for the entire semester?
No, that's actually one of the things that we will be reconsidering after the first 2 weeks of the semester. And as Dean Schoenberg mentioned already, we really are always reconsidering the policies. We're always giving thought to what policies need to change as we learn more information. But that is one of the things that we are slated to give specific consideration to 2 weeks into the semester.
Thanks so much. Dr. Smith, one person asks, if you've had the Omicron variant, will that protect against any future variants that might appear?
It's a great question about immunity. Immunity is most pronounced, right? You're gonna enjoy the best benefit when you've had a recent infection. And what we see with this virus is that immunity will fade with time. Not only will that immunity fade with time, but the virus will continue to mutate, and there will be eventually, I guess we get to the Omega variant, right? That's what we want, the last one, right? But as the virus continues to change, that immunity will become less and less. And so the answer is actually that, immediately, probably, you're unlikely to catch COVID, 2 months in a row, 3 months in a row. But as a 6-month, 12-month period goes on, that immunity starts to fade.
Excellent, thank you. Johanna, there's a question about knowing information when you're going, when you're getting tests, and if you've submitted information about full vaccination forms and whether or not you can skip gateway testing. I wonder if you can talk about the way in which we communicate with people about these various touch points that they need information on.
Yes, so basically when you go to Gateway and you test there, since this year we have the ability to do rapid PCR, you get the results in 30 minutes. So we get the email directly sent to our team, the contact tracer team, and the on-call team for isolation purposes. And the student is immediately isolated. So you will be notified of your result right there at Gateway. And then we will enter you into our contact tracing system and we'll contact you. And residential on-call will get with you and isolate you if you're a residential student. If not, you will be provided with instructions in how to isolate if you're a commuter student. And obviously, if you're an employee, same scenario, we get an email here at Stetson Health Service. We enter the information into the tracker, we update the record, and then we communicate with you to start contact tracing.
How does a new or returning student know if they have to do gateway testing?
Lynn, do you want to answer that one?
Yeah, sure. So if you need to do gateway testing, you have gotten a lot of emails. There's no way, if you're checking your Stetson email, you're well aware that you need to go. So if you are not getting those emails, then you're okay. But if you are nervous, we can put the COVID testing email address in the chat and we can check you out.
Excellent. There was a question earlier about how students stay engaged in classes if they contract the virus, if they have to isolate because they've been exposed. If we tell you, if you get that kind of communication that Lynn and Johanna were just talking about isolating, this is not like you're going to be penalized for having missed a class. We are telling you as an institution that to keep the institution safe, you need to isolate yourself for the time period that you're being instructed to isolate and follow the guidance that you're receiving. That will keep us all safer if you adhere to that. Our faculty are going to be doing their best to identify ways in which you can stay engaged in the classroom assignments that are moving forward. You should receive instructions from your instructor, and if you don't receive them, then you can reach out to your teacher and ask exactly what they'd like you to do. There's no requirement that they move their class online and give you a video to watch of a synchronous class period. Like I say, it's up to the faculty member to decide how you continue to progress. Our expectation is that you are provided the opportunity to continue your learning experience even in the isolation or quarantine that you have to go through. It's really the best advice to contact your faculty member, to let that relationship that you have with them be the guide through that period. Now, there are cases when a class may have to move online, as we said a minute ago. If that's the case, then again, your faculty member will be communicating with the entire class about that. And there may be situations where the faculty member contracts COVID in a way that is symptomatic, and we don't require that our faculty member are sick and teaching at the same time. So that if that's the case, then the faculty member will identify whether it's possible in that short time period, hopefully, to continue the learning experience, or if classes have to be managed in a different way or even canceled. But we're looking out for the health of students and faculty in that. And at the same time, students, we want you to continue learning as is best possible throughout this entire time. Dr. Smith, one person is asking about Omicron in specific as it's connected to the vaccinated population versus the boosted versus the unvaccinated versus immunocompromised. And I think you've addressed some of that. Is there any particular point that you want to emphasize about how different populations are responding to Omicron?
You know, so far, I don't really have enough information to comment on that, except to say that obviously if you're immunocompromised, you're at increased risk of contracting the virus. I can tell you that the handful of patients that we have who are getting very sick with this, most of them do have some underlying comorbid conditions. So this is less likely than Delta to take a normal healthy person down the way that Delta did and put you in an ICU type situation. But it's not a zero risk, game out there. And so you may or may not know if you have an underlying condition also is something else to consider. So as far as the vaccinated and the boosted are doing better than the vaccinated, who are doing better than the unvaccinated. So same story there as with Delta.
Thank you. Dean Schoenberg, how do students have their voices heard in the decisions that are made by the university?
Love that question so much. We do have 3 student members of the Stetson Safer Campus Task Force. We're actually really lucky. Those 3 students have been with us for quite some time now. Maybe I think one of them over a year. And so they are really in the weeds with us. They're involved in every decision that we make. They bring a wonderful student voice to our team. Often multiple members of the staff who are on the team will say, well, that we needed to hear that. Thank you. Right. It's so great to hear that perspective from student, and they represent different parts of campus. So we have a student who is very active health science major on the pre-med track. We have a student who is one of our Student Government Association senators and was put forward from student government to serve in that capacity and report back. And we have an RA who is also, as an RA, as a resident assistant, a special position that helps with our isolation and quarantine. So these 3 students are really in the muck with us. And then myself and my co-vice president for campus life and student success, we meet with our SGA president and vice president, Lana and Josh, on a very regular basis, have pop-up consultations. They know about our changes that we're making, and we talk about how to communicate and what that looks like, usually in advance of the larger community. And I know there's some athletes that are also helping to do some of that with athletics as well.
Thank you so much. Professor Radwin, you're a faculty member at the College of Law. What information does faculty get about students who might be testing positive, or exposure, or even the results of gateway testing?
So obviously, due to confidentiality issues, faculty members don't necessarily find that out. As a faculty member, I'll be honest with you, most of the time when I find it out, it's from the student directly, who lets me know that they've tested positive, they're not going to be able to be in class. And that helps me to work individually with the student. I also hear from our associate dean, who will let me know if there are students who need, but they may not disclose who the student is, as much as that they need to work with me to figure out how a student will be continue to be engaged in class, and particularly if the student is ill enough not to be able to participate at that moment. So while there is a tremendous amount of discretion for faculty members to help figure out how to engage students, we also have to respect the confidentiality necessary around health information. And so it's a little bit of finding out in different sources. But again, most often it's actually the student who lets us know directly.
Thank you. And it is a promise that we've made. Appropriate confidentiality is a promise. And I've seen us adhere to that as well. Lynn, there are a number of questions about various policy things. You know, can we require certain types of masks? Are we going to reinstate the COVID leave for employees? And I wonder if you could just talk about how we as an institution make those types of decisions. We haven't made those decisions, nor in either of those cases have we had the discussions yet, but how does that conversation happen?
Yeah, so many times that conversation will start at Safer Stetson level. There are 22 members of the Stetson Safer Campus Task Force from both campuses, as I mentioned, including students and people who have expertise in really different areas, like Benita Dukes, who's got so much expertise in facilities, the environment, proper hygiene, to our own Joanna Burgos, who's here as our medical professional, a wide range of experience. And we talk things out. We have difficult dialogue, right? When we talk about difficult dialogue, sometimes we're not on the same page. We ask for 1 or 2 of our members to bring research, bring information to us so that we know what the experts are saying. Sometimes we have to reach out to the Department of Health or to Advent to get specific information for our area in that regard. And certainly Joanna is wonderful and amazing in that capacity, helping inform us. And then we talk it out. Terry and I lead. We try not to direct or push. We try to let everybody speak and have a chance, and we vote. We take votes. And then if Safer Stetson is making a recommendation, it then goes to the president and the vice presidents for review. That, I have a weird spot because I'm currently part of both of those groups, and the VPs kind of do the same thing, right? We talk it out. We don't always agree, right, Provost Pager? We, have multiple perspectives that are shared. Sometimes the VPs send things back to Safer Stetson and ask Safer Stetson to look at it in a different way or a deeper way. And then final decision is made at that level. When there are things that the community is asking us to do, like I have noticed in the comments here, a couple of requests about potential for requiring different kinds of masks. Well, look at that. Now we have that piece of information, Safer Stetson will take it. And I think we've gotten much better over time. We have done all the little pieces. We don't need to talk about isolation. We don't need to talk about tiers. We have done that. So we can start to expand even more and talk about some of these more challenging pieces. So we want you to tell us when there's something that you want us to consider, and we'll keep talking about it. But it is a process. We don't make quick decisions unless it's urgent and we have to. And we try to make them as informed as is feasible. We bring in guests sometimes to talk to us and share information. So I don't know if my co-chair, my other teammates have other things to say there, but the actual action of Safer Stetson, considering things and making decisions, I mean, it's one of the best groups I've ever been a part of in its capacity to make decisions in really tough situations, while keeping the most important things at the top of the priority list.
And the reason that I asked that in part too is, many of you have asked questions that we haven't addressed specifically. That doesn't mean that we're ignoring them, that we're in our minds forming a list of things for us to talk about. And as Dean Schoenberg just said, there's a Safer Stetson list that goes, that she is building through the questions that are being asked in this webinar. I am certain that the operations team is going to have conversation around whether or not it's time to reinstate COVID leave as we have had it implemented now for quite some time. So that's one valuable outcome of your participation in a webinar like this. As we get toward the end, I think it's important to address the situation we find ourselves in right now with availability. And there's a question about availability of hospital beds, availability of tests. If someone is having symptoms and they're unable to find a test at Walgreens or CVS, what do they do? What's going on in that regard? So Dr. Smith, I wonder if you can give us kind of an overview of what your recommendation would be in the current landscape of testing and hospitalizations.
Sure. So the Department of Health has a nice website up that'll show you everywhere that there are testing locations for the public. Stetson is obviously offering testing, as Joanna touched on earlier, so you don't have to go to a public venue if you wish not to. And then I would monitor also the Speedway, which is a little bit of a drive for you guys, but is our kind of hub here in Volusia County for public testing. Availability of services. Right now, we are extremely busy, as you would imagine, in the ER and the Centricare venues. I mean, they are really jumping, and that's good and bad. That's good because we see that a lot of people are coming in, they're getting tested, they find out if they're positive or negative, and they appropriately go home and isolate. The other good piece of that is we're able to discharge the vast majority of those patients home because, as I said, most of these patients, it's not getting into the deep lung tissue and really causing the respiratory failure issues that we saw before. But those emergency services are stretched. And so I think it's important not to come to the emergency department just for testing the way that we see some folks do. If you're asymptomatic, that would be a very long wait for you, and with a positivity rate as high as 40% throughout Florida in Centricare, you really probably don't want to be in a room full of people unnecessarily that are there to find out if they have a respiratory illness. I would say that our ICUs, our inpatient side, we're doing relatively well. We're not seeing that same high acuity. Our challenges, just like the rest of America, are we are getting this at the grocery store and the gas station like everybody else. And so we have people that are calling in sick. And even if they're not that sick, say, hey, I had a fever. And we have to be extra careful in the healthcare world because we work with patients who are immunocompromised. And so it's really irresponsible of us to come to work sick. And so we have to be a little bit extra vigilant. So those are the issues we're seeing. We're not seeing the issues that we saw with Delta, where we were really, maxed out on our ability to provide ICU level care. That's not it. It's more of a bottleneck just because of how many folks are being infected with this, so that you can expect longer wait times for the ER, but safe care.
Perfect. Thank you. Last question of the day is something that I have heard several people say, and that is, if I get infected, that serves just as well as getting vaccinated or getting boosted. I don't need to get vaccinated, or I don't need to get boosted if I have had the Omicron variant. Is that true?
No, that's not true. And I put my money where my mouth is. I got three shots after I had COVID, and it's for all the reasons we talked about before. Your immunity over time will fade. That's why, those of us who had chickenpox in childhood, we get shingles when we're adults. It's the way, that's why you get the flu maybe more than once in your life. And so, as viruses mutate, as that immunity fades, you get further and further away from your exposure, those boosters are what are going to keep you safe and keep other people safe. The life you save may not be your own. So.
A great last word for us all. Dean Schoenberg and Director Burgos and Dr. Smith and Professor Radwin, thank you so much for the way that you are adding to our response at Stetson and making it as safe a learning environment as is possible. We're going to put a PowerPoint up on the screen that has some information that you may want to jot down or take a screenshot for, some dates for PCR rapid gateway testing and open testing that's available on Wednesday. You can be assured that we will continue to communicate with you throughout this spring semester. We'll continue to have webinars like this that give you information about the decisions that we're making. And as Dean Schoenberg said earlier, we are continually evaluating the things that we are facing and making decisions as are appropriate for this great institution. We appreciate all of you who have been part of this webinar today. Again, a special thanks to the panelists. And I think I can't end this if I'm filling in for the president without ending the way that he would end. And I would ask everybody on the panel to join me in saying all together, go Hatters.
Shutters.
Y'all have a great day.
Bye.